Good afternoon. On behalf of my colleagues from Pontificia Universidad Católica de Chile, I'm going to present to you our work titled Hobnail variant papillary thyroid cancer by itself is not associated with a worse prognosis than classic variant, a propensity score analysis. As many of you may know, the Hobnail variant of papillary thyroid cancer is the most recently described aggressive variant of PTC. It is defined by WHO in the presence of at least 30% of hobnail component within a papillary thyroid cancer, usually with a micropapillary architecture, apical nuclei, and high nuclear to cytoplasmic ratio. It was initially associated with many aggressive features and a short-term disease-specific survival near 50%. However, recent studies have shown that a significant proportion of Hobnail variant have less aggressive clinical presentation and a better prognosis. Also, today, there are no studies that directly compare the clinical presentation and prognosis between Hobnail variant and classic variant of PTC. So our objective was to evaluate the prognostic relevance of the Hobnail variant by itself compared to classic variant after adjusting for the most relevant clinical pathologic covariates. This was a retrospective analysis of a prospective cohort. We included 431 patients, 18 years and older, consecutively treated in our institution. Our inclusion criteria were diagnosis of Hobnail variant or classic variant by expert pathologist, according to WHO criteria. Treated with lobectomy or total thyroidectomy with or without lymph node dissection, and a follow-up of at least 6 months. The risk of recurrence was classified according to ADA guidelines, and the risk of mortality was classified according to the 8th edition of AGCC staging system. We performed periodic follow-up with TG, TGAB, and imaging according to the initial risk of recurrence and response to treatment. And the target TSH was according to the initial risk of recurrence and response to treatment as well. In order to isolate the effect of the Hobnail variant, we conducted a propensity score with covariate adjustment analysis using a model that included the variables that were significantly different between the Hobnail and classic variants. And finally, through a logistic regression, adjusting the Hobnail variant by the propensity score, we evaluated the impact of a Hobnail variant alone and other clinical pathologic variables on persistent recurring disease defined according to ATA criteria. Here in table 1, you can see our 32 Hobnail variant patients, almost 400 classic variant PTC, no differences in age, Hobnail with a high proportion of male patients. As expected, a shorter follow-up being a novel variant compared to classic variant. Regarding type of surgery, it's not completely unexpected to have a higher proportion of lobectomy in patients with Hobnail variant. This is because, probably because this is a recently described variant that matches the age of individualized management of papillary thyroid cancer patients, which includes extension of surgery. So this 12% is not completely unexpected for us. Regarding size, Hobnail patients have larger tumors than classic variant. And remarkably, there were no differences regarding extrathyroidal extension, angioinvasion, or mitosis between both variants. What happens with the TNM? There was patients with Hobnail variant had a more extensive clinical presentation than patients with classic papillary thyroid cancer. You can see patients with Hobnail with a higher proportion of patients with T3 and T4 tumors, N1 tumors, and M1 tumors too, okay? However, as you can see, there were no differences in the AGCC edition, mainly because with this new edition, it's quite difficult to identify patients and classify patients as stages 2 and 3. So it's quite expected that we didn't find a significant difference. Different behavior with ATA to 2015. Obviously, there are no low-risk Hobnail variants, but there were a significantly higher proportion of patients with high risk of recurrence compared to patients with classic PTC. Regarding radioactive iodine, quite remarkable that 50% of our cohort of Hobnail variant patients did not receive radioactive iodine, with no differences compared to classic variant. And this lower median dose of radioactive iodine of our Hobnail patients is following the line of the surgical extension, because this is a novel, recently described variant. It is expected that these patients have been treated and followed according to newer guidelines with more personalized management. And the most important thing on this slide is that the rate of structural or biochemical incomplete response was very similar between both variants. So, as I commented before, we wanted to isolate the effect of the Hobnail variant for predicting persistent recurrent disease. We built this propensity score based on the variables significantly different between Hobnail and classic variant: age, sex, type of surgery, tumor size, extrathyroidal extension, TNM, ATA, and length of follow-up. And as you can see, after adjusting for the propensity score, the odds ratio for persistent or recurrent disease was non-significant for Hobnail variant by itself. Knowing this, we wanted to know which variables did have an impact in persistent recurrent disease. So in univariate analysis, the following variables were significantly associated with persistent recurrent disease: tumor size, extrathyroidal extension, TNM, AGCC stage, and ADA risk of recurrence. And after performing logistic regression, you can see that only N1 status and ATA high risk of recurrence were significantly predictors for persistent recurrent disease. M1 status probably didn't reach significance because of the small number of patients with this condition. So in conclusion, in our series, Hobnail variant PTC had a more aggressive clinical presentation than classic variant. However, after adjusting for clinical pathologic covariates, the Hobnail variant by itself was not associated with a higher risk of persistent recurrent disease. N1 status and ADA high risk of recurrence were the only features associated with persistent recurrent disease. And all of these findings highlight the importance of a thorough evaluation of all clinical pathologic factors in patients with PTC, not only the variant, allowing the clinician to individualize the risk of recurrence and the most appropriate therapy for each patient. Thank you very much.